this week's Cardiology Countdown, we begin with a publication in Lancet that was presented at the ESC, the Dal-PLAQUE trial, that was one of the phase 2 safety and early efficacy trials of one of the cholesterol ester transfer protein inhibitors, dalcetrapib, that has been seen to raise HDL. This was a study to first exclude harm since torcetrapib had increased mortality and other cardiovascular events, the first of the CETP inhibitors. It was a study of about 130 patients that used MRI of the carotid as well as PET-CT, looking at the vessel, and also measured blood pressure and other safety parameters. It met all the safety endpoints and showed no harm, but showed intriguing benefits on the total atheroma area in the carotid. Not all endpoints showed improvements, but some intriguing benefits that this class of drugs may modify atherosclerosis. It's being tested in a large outcomes trial, DAL outcomes at present, and other agents are also in testing. At the number 2 spot is a meta-analysis published in JACC that looks at erectile dysfunction and the risk of future cardiovascular disease. They identified 12 prospective cohorts involving over 36,000 patients. And in those who had evidence of erectile dysfunction, they were associated with about a 50% increase in the risk of cardiovascular heart disease, either cardiovascular death or MI, about a 35% higher risk of stroke, and 19% higher risk of mortality. When looking at studies that had controlled for other known risk factors, hypercholesterolemia, hypertension, etc., this seemed to hold up. So they suggested this may be independent of the coronary risk factors. And so a risk factor for people to monitor for the future risk of cardiovascular events. And finally, another meta-analysis, this published in the archives, that looks at the impact of QRS duration on the benefit of cardiac resynchronization therapy. As we know, cardiac resynchronization therapy is applied to patients with a QRS greater than 0.12. But there's been greater benefit seen, and in this meta-analysis of the 5 randomized trials, a significantly greater benefit was seen if the QRS duration was greater than 0.15, with a non-significant benefit between 0.12 and less than 0.15. This has been incorporated already in guidelines and provides the robust data set to support that. So with this week's Cardiology Countdown, I'm Chris Cannon.